Edler, would you yield?
Yes, I will.
Senator Wahls, you are in order.
Thank you very much, Madam President. Senator Edler, just a couple kind of clarifying questions from our caucus. Some interesting language in this legislation. I don't think I've ever seen this. I haven't been here for very long, but I don't think that I've ever seen a piece of legislation state that it is not proactively state that it shall not constitute a violation of any provision of Chapter 216. For those folks watching at home, Chapter 216 is the Iowa Civil Rights Act. So in this legislation, Senator Edler has taken it upon himself to make sure that folks know that compliance or enforcement of this law shall not constitute a violation of any provision of the Iowa Civil Rights Act. And Senator Edler, I was hoping that you could just explain for the body why you felt it was necessary to include that language.
Absolutely. This is a public health concern. This has nothing to do with civil rights of Iowans, period.
But the bill does restrict what health care someone can access based on their gender identity, correct?
This is based on the long-term effects of the procedures and or the hormone therapies that are being applied on minors. These are experimental, non-FDA approved procedures that should not be done on children.
Well, I mean, Senator, subsection 2 and section 1 specifically states that this only is relevant if it's relevant to someone's gender transition. I mean, is that not the intention of that subsection?
Due to the dosing levels to get those results is what creates the public health situation.
So access to all of the medicine and other medical procedures in this legislation are actually acceptable if they're not related to a gender transition. Is that what you're saying?
Repeat that for me one more time, please. I'm losing you here.
No problem. You're saying that if the individual, if the patient is transgender, there are certain drugs and procedures that you cannot access, right? But that someone who isn't transgender can access. I mean, puberty blockers are a routine prescription for several conditions for people who are not transgender. So that person won't be affected by this legislation.
So let me just go through this word by word. Except as otherwise provided in paragraph C, a healthcare professional shall not knowingly engage in or cause any of the following practices to be performed on a minor, nor refer a minor to another healthcare professional to perform any of the following practices on a minor, if the practice is performed
Sorry, Senator,
for
which
the
page
purpose of attempting to alter the appearance of or affirm the minor's perception of the minor's gender or sex, if that appearance or perception is inconsistent with the minor's sex.
So these prohibitions only exist within the confines of attempting to alter the appearance of or affirm the minor's perception of the minor's gender or sex, if that appearance or perception is inconsistent with the minor's sex. So this does not apply, any of this, to young people who are not going through that alteration. That's what you're saying.
This is only going to apply to what I just read. That is correct.
So this, just to make sure we're on the same page, this only applies to young people who are receiving this treatment for the purpose of attempting to alter the appearance of or affirm the minor's perception of the minor's gender or sex.
Correct.
Right. So just to be clear, that's why you feel it's important to specify that this is not in violation of the Civil Rights Act. Because this is targeting a specific group of people. It's targeting only those minors who are receiving this care for this specific purpose.
This is a prohibition under the public health chapter of Iowa, not the civil rights chapter.
Well, then why are we talking about the civil rights chapter?
We are clarifying that this is a prohibition in the public health chapter.
Would you think of anyone aside from transgender people that the bill, like, who would need gender-affirming care? Like, is there another group out there that I'm not thinking of?
I'm going to have to ask you to repeat that. I'm trying to soak this in as I go, so.
No, that's totally fine, Senator. So we're on page 1, lines 19 through 23, where you just said that these prohibitions only apply in situations where you're trying to affirm the minor's perception of the minor's gender or sex if that appearance or perception is inconsistent with the minor's sex. That's what we're talking about. Is there anyone aside from transgender people who would have that goal for treatment?
I cannot answer that question. All I know is because of the purpose of what I earlier read leads to higher levels of dosing and or surgical procedures that cause lifelong harmful effects.
But to be clear, I mean, you, I'm sure, would agree that transgender people are like who we're talking about here.
I cannot agree to that. I will only agree to the fact that I read exactly what the bill covers, and that is not in the bill. So, no, I cannot agree to that.
But you, and Senator, again, I'm not trying to belabor this point, but you can't think of somebody other than transgender people who would be trying to receive this care for the purpose of attempting to alter the appearance of or affirm the minor's perception of the minor's gender or sex. You can't think of a group of people other than transgender people who would fall into that category.
Once again, I am going to repeat, this is a prohibition under the public health section and chapter, that becomes a public safety or public health issue because of the levels of induction of the chemicals and or the types of procedures the individuals who have been described in the bill or patients have received.
Okay, so, I mean, doesn't it seem clear that the bill does restrict health care that someone can access because of their gender identity? We're almost done, I promise.
Go ahead again, sorry.
Yeah, no problem. I mean, just based on what you just said, doesn't it seem clear that the bill does restrict access to those chemicals that you referenced based on their gender identity?
Not necessarily. I would say that it is applicable to all minors who would be seeking puberty blockers under gender transition.
Okay, exactly. So it applies to minors who are seeking these chemicals
All minors.
Okay, so are there any minors trying to undergo gender transition who aren't transgender?
I have no idea.
Fantastic. Last question that I have for you. Effective date versus applicability.